Assalamualaikum and hello everyone. I'm Dr. Nidaliana from the Department of Social and Preventive Medicine, Faculty of Medicine, University of Malaya. Before I proceed, I would like to acknowledge my team members from the Faculty of Medicine, Faculty of Arts and Social Sciences, and Faculty of Computer Science and Information Technology, as well as colleagues from other organizations who were involved in this project. The title of our product is To Heal. Globally, 10 to 20% of young people experience mental disorders, and the prevalence is greater among youth aged 16 to 24. In Malaysia, the prevalence of mental health problems among individuals aged 16 and above increased approximately threefold from 1996 to 2015, as you can see from the figure. The 2015 National Health and Morbidity Survey reported that the prevalence was highest among youth aged 16 to 19 at close to 35%. The 2017 National Survey, which focused on young people aged 13 to 17, showed that the most prevalent mental disorder was anxiety at close to 40%, followed by depression at 18%. The most recent national survey reported that nearly 10% of 10 to 15-year-old adolescents have mental health problems. In Malaysia, the Ministry of Health is the biggest mental health service provider, with all the services provided by the MOH and various NGOs through various platforms. Some gaps still exist. Stigma, for example, has caused the underutilization of healthcare services by young people as they are afraid of other people's perceptions. With regards to mental health apps, most of the apps are web-based and developed based on individual experience, and they focus mainly on screening and interpretation of results. Also, it lacks mental health intervention that tailors to the specific mental health problem. Apart from that, the app often targets the general population and they lack evidence-based. In 2017, we were given an opportunity to develop a mental health app through a program called Preventing Mental Health Problems Among Malaysian Youth. The main objective of this program was to identify an effective mobile app-based health intervention for dealing with mental health issues among youth and to assess the app's usefulness. This work is a collaboration between the disciplines of public health, psychology, and computer science. The To Heal application was developed by public health medicine specialists, psychologists, and computer science and information technology experts. The app is easy to use, and users can obtain results of their mental health status within 10 minutes. In addition to that, users do not have to worry about confidentiality as it performs discrete self-screening. After the self-screening, users will be navigated to specific mental health support based on their score. One of the important benefits of the app is it helps to increase user awareness and prompt them to seek help. For patients who are undergoing psychiatric treatment, self-screening can be done while waiting for the next appointment. So this will prompt them to seek immediate help if necessary. Last but not least, the app provides an evidence-based platform for users. We started with a qualitative study to identify the risk and protective factors of mental health problems among young people. We conducted 28 interviews and focus group discussions among youths aged 15 to 22 in urban areas of Kuala Lumpur and Selangor. From this study, we produced a causal structure framework for mental health problems. Based on this framework and a systematic literature review, we then developed a mental health screening questionnaire which screens for a person's emotional states, that is depression, anxiety, and stress, risk factors for mental health problems, and stressful life events and coping skills. The English and Malay screening items were validated and the tool was found to be reliable and valid. After we have developed the screening tool, we then incorporated the tool into the 2Heal app. This 2Heal app also provides health education and activities to improve mental well-being. All the activities were based on evidence that we have gotten through systematic review. After the app was completed, a brief evaluation was done whereby we got feedback from young people about the app. Then, based on the feedback, we did some revision, added more features, and improved the screening questions. In our latest development, we have run the app in a project entitled Community-Based Mental Health Promotion among Low-Income Adults using Online Interventions. In terms of practicality and usefulness, the 2Heal app is easily accessible, whereby it can be used anytime and anywhere by Android users. It provides early screening of mental health status and increases users' awareness and prevents the worsening of stress, depression, and anxiety symptoms. At the same time, it navigates the user to appropriate mental health activities based on self-screening scores. Access to helplines is also available, such as Befrienders. We did a brief evaluation of the app by distributing the link and questionnaire to 20 young users. We found that a majority said that installing the app was very easy. Most of the respondents said that the screening questions were easy to understand, and 90% of the respondents reported that the app was helpful. We also introduced this app to a depression survivor group, and the feedback was positive. According to one respondent, he had no issues with the screening questions as they were simple and fun to answer. He also said that he had fun having able to self-assess his current mental health, and for him, the app can be used to assess his mental health status in between his follow-up with a psychiatrist. There is no specific commercial value for this app. However, the app is available for free to Android users. At the university level, the Center for Counseling and Disability Empowerment University Malaya promotes the app to students to increase awareness and prevent mental health problems. Thank you for listening to my presentation and have a very good day.